had liver disease, NAFLD, and then it progressed to a disease called NASH, which is non-alcoholic steatohepatitis, because it was misdiagnosed for years, progressed to cirrhosis. So she was in a subacute rehab after a hospital stay, just for some minor procedures. That CMS shoves the patients now into a subacute rehab for strength training, and she was allowed to fall as a fall risk, which started a huge cascade of problems for her because she ended up with a hematoma the size from her armpit to her hip, and your liver metabolizes that blood, and so it got overworked, which caused kidney issues, and she was already at risk for a syndrome called hepatorenal syndrome because of the constant diuretics, et cetera, for the liver disease. And so it turned out that at the time, one of my best friends was a nephrologist, and his wife was an RN case manager, and my mom was allowed to start dialysis in the hospital, which I think had I not had the connections, she probably wouldn't have been allowed to start the dialysis because they know the situation that I was not aware of. And so once she got the dialysis, then when it was time, she was getting better and wanted to come home, they said, well, she needs to go to a long-term acute care. And I was like, well, no, I don't want her to. But it turned out that was the only place she could get dialysis access because of her comorbidities being a high risk. No dialysis clinic in the entire state of Indiana, Fresenius or DaVita, would accept my mom into the clinics because with her liver disease, she was at risk for low blood pressure and all kinds of little things could happen. And I was told off the record that, well, Nancy, if your mom has an episode, an issue, an emergent issue in the dialysis, we have to call 911 just like you would. And she got, we can't put the doctors or the nurses, license at risk. And, I actually was trained as a surgical technologist, was going on to become a physician assistant, and I just honestly had no idea. I thought if you had a prescription for dialysis, you just got your prescription filled and sent to the clinic. And so I watched my mom as a caregiver suffer the last 3 months of her life because she wanted to come home. She wasn't on IV drugs, she wasn't on oxygen, she wasn't on anything that required her to be in that long-term acute care, and it was a god-awful place. I wouldn't say a dog or an iguana even to this place. It's horrible. And all they wanted to do was push her into hospice because they also knew, and they actually had applied for a license for 74 more dialysis beds, which thank God they were denied, but I realized they had this captive audience of people that could not get into a dialysis clinic, and then hospice with CMS and good old Medicare pays off on the first day of hospice. So I caught the doctor sitting on my mom's bed, patting her arm and going, if you just sign this paperwork, it can all be over by tonight. And I caught him and I told him to get the hell out, and I forbid him, but he was the doctor and he was actually the medical director. And so I would apply to every place. I begged. I called at the time Senator Joe Donnelly's office, Congressman Luke Messer's office. I called at the time Governor Mike Pence's office. Donnelly and Messer pretended like they were innocent and would do something, but nothing ever happened. Mike Pence actually never responded to me. The state representative, Senator on the state level, Luke Kinley, did respond to me, and he said, I'll try and help you all I can. And, we would tell my mom, I live with the guilt because we tell my mom, now, do your physical therapy and eat everything, we'll get you out of here and get you home because you just say you want to come home. And after months, we could not get her home. And so one of the things that breaks my heart to this day is next to Christmas, my mom's favorite holiday for some reason was always the 4th of July. And so we would tell her, keep getting stronger, you're going to go home and see the fireworks. Well, it got to be the week of 4th of July and she was in the in the hospital. So I worked with everybody. I said, I'd like to take my mom out so she can enjoy the fireworks. They said, okay, fine. Fresenius was their contracted, so Fresenius would do dialysis in the long-term acute care, but they wouldn't take her in a clinic. And so Fresenius would show up whenever they got the urge to show up, apparently. So she was scheduled for a 9 a.m. Dialysis treatment, didn't show up till 6:30 that night. So her last 4th of July Missouri, she was getting dialysis instead of getting to even look out the window at the fireworks, which is, it just makes me sick. And the thing that I found out with my mom is there are no doctors on site, there are no RT, respiratory therapists, there are nobody. And so that's why with her, that she had a high risk, they didn't want her. And I thought when I was telling all these people, I was discovering something new, that, this is like the Twilight Zone, I can't believe this is happening to my mom. But it turns out it's been the secret, dirty secret, like they talked about, nobody wanted to discuss. My first experience is I contacted the National Kidney Foundation, which is one of the people I was begging for help. And I ended up, after her death, I went to a panel where the CMS Dialysis Compare head was there, the American Association of Kidney Patients and National Kidney Foundation, and they said, oh, you know, this is, you know, cherry picking and blacklisting. I can't believe this happened. It makes my hair stand on fire. And so I thought it was still something kind of new, and then later is when I through social media got acquainted with Arlene and dialysis advocates to find out, no, it was a common known practice that many people have died from. And you know, like I said, it makes me sick that I watched my mom suffer for 3 months begging to come home, and there was no way to get her home. And like with the Fresenius clinic in Indiana that was closest to us, the one doctor had 12 clinics in that area. And so once he said no to one, he was saying no to all of them. And then basically once one clinic says no, then DeVito or whoever else is gonna follow suit, which is the blacklisting. And so, I mean, there's no option except for a long-term acute care, and all they want is hospice, because then they get the payout for the hospice. And so, you know, it's my mission now in life to expose what's happening, because my mom died, the caveat at the end is because I was trying to make as much noise, and I had started like an online petition and change.org. I had a Facebook page, you know, please share this. And I did have a local newscaster that was gonna put me on the television. I made a stupid mistake if I told an ethics board about this. And so my mom started having some respiratory things, which had nothing to do with the dialysis, and it's something that she regularly had with her liver disease. And usually they just put her on BiPAP for an hour or two, she'd be fine. And the doctor looked at my dad and said, well, I think it's time. And basically, they knew about the meeting that was gonna be on TV the next day and convinced my dad no more. And so, you know, even if my mom had only had 3 weeks, 3 months, or 3 years, she should have been allowed to be at home. People should at least, and I was a surgical technologist, and the doctors would say, well, Nancy, why don't you take her home and do, you know, the hemodialysis at home? Well, I couldn't, because I couldn't get her into a clinic for the 5 or 6 weeks to train. So, I mean, you know, Fresenius and DeVito wouldn't even take her for the risk of the 5, and it all, you know, boils down to the funding from Medicare CMS and all the funding they want, and they don't want their little star rating system.
It goes to